In this lesson, I'm going to be explaining the postpartum physiological changes that happen to mom, and then your role in providing care for the patient with these changes. So let's first look at what time frame we are talking about when we say some of these terms. So postpartum is the time immediately after delivery until about 6 weeks postpartum. And then during this time, the maternal body is returning to that pre-pregnant state. So during this time, a lot of changes occur during the pregnancy, and some women have a very hard time during this time to get back to the pre-pregnancy state. Just remember, it took 9 months for their body to get to this state, and they did just have something super amazing happen. So now it's going to take time for their bodies to get back down and get to that pre-pregnancy state. So during this time, one of the biggest changes occurring is involution. So involution is just referring to the uterus shrinking back down to its pre-pregnancy state. So just going back down into that pelvis. There's so many different changes that are occurring. So let's take a look at those. So first I want to show you this little mnemonic, the bubble mnemonic for your postpartum assessment. It is breast, uterus, bowel, bladder, lochia, which is the bleeding that happens after. And then the E stands for 3 things. Some instructors might only include one of them, but there's 3 things that you need to know. So I do all 3. So the E stands for episiotomy, emotions, and then the extremities, because all of these are super important. So this is just the general order from top to bottom that you do for your patient for assessment. And you've learned your basic head to toe assessment for your med-surg patient. You are still doing that. But now, because the pregnant patient or postpartum patient is a little different, has some different things going on, you're also adding this bubble assessment into your head to toe assessment for these patients. So now that you have all that tucked into your brain, let's look at the assessment in more detail. All right, so our B, our breasts. So we're going to break this down a little bit more. So the breasts are going to produce something called colostrum, and that's the pre-milk. Like we call it liquid gold. It's kind of a yellow color, and this is the milk that is going to feed that baby in the first few days before the breast milk actually is developed and comes in. So the second that placenta is removed, the hormones drop significantly in the body. And so the body kicks into action. We got prolactin now, a new hormone that's being produced. And so that is going to help have the body produce the breast milk. All right, our uterus. So with this, we have rapid shrinking and involution occurring. So that uterus is undergoing a major change, right? It just contracted out a baby, pushed out a baby, your mom pushed out a baby, and now it's going to rapidly shrink and have involution occur as it goes down into the pelvis. So by 6 weeks, that pelvis should house that uterus again. So that uterus should be back in. Now, a patient that chooses to breastfeed is going to have more rapid shrinking, and that's because with breastfeeding, we have the natural release of oxytocin, which is going to contract that uterus down even quicker. So breastfeeding is going to help with that involution. All right, now moving on to our next B is bowel. So what's going on here? For our patient, they might have some hemorrhoids from the pressure of carrying a baby, but also from pushing. And then they might also experience some constipation. So our bladder, the body system, the GI system is going to undergo some changes. So, they are getting all this extra fluid. They have extra fluid during pregnancy, and then they're also given extra fluid while they're in labor. And so with this, they're going to have a big diuresis occur. So those fluid shifts that are going to happen to get that extra fluid out of the body because we don't need it anymore. And then lochia, or L. So this is just bleeding, the bleeding that happens after delivery. So it's a progressive bleeding. So first we have rubra, which is just the red blood, bright red blood. And then we have serosa, which is where it gets a pinkish brown color. And then alba, which is white. Now, remember, this is a natural progression, so that's important to remember. You should not get to white and then all of a sudden be back to red. That's a sign that something's happening, something's not healing correctly, or that the patient's doing too much. So we would want them to let us know if that happened. So it should be just a natural progression. Now, your patients in the hospital are really just going to stay with the rubra. You're not going to see this transition because the rubra lasts for about 10 days. And altogether, the lochia is going to continue on for that 4 to 6 weeks, and then they should stop bleeding. Again, for our patient that's breastfeeding, they're not going to be bleeding as much, and they should stop bleeding a little sooner. They might only bleed for about 2 weeks after. But with this, we want that to be a natural progression, and it should stop by that 4 to 6 week point. And then our episiotomy and extremities. Since we're talking about physiological, I'm not including emotions, and that'll come up in a different module. So just our episiotomy and our extremities. So with this, where both of them are going to have swelling. So that episiotomy, if you remember, is that little cut that's made to allow room for the baby to come through. So there's going to be swelling. There's going to be loss of tone in that perineum that might never return. And then in the extremities, we're watching for blood clots. So just some edema that might happen, unequal edema, the change in color of that extremity, just things to watch for. Now, what is our management going to look like for this patient? So therapeutic management will be pain medications to help with these after pains and those cramps that are felt. So some of the medications are ibuprofen or Motrin, oxycodone, and then just Tylenol, acetaminophen for the patients that maybe don't want the narcotic but need something else to take the edge off. Ice packs, super important for our patients to help decrease swelling on the perineum and also decrease the risk of a hematoma from happening. So ice packs, super important. Tux pads and stool softeners. So Tux pads have something in it called witch hazel, and that's just going to help with hemorrhoid pain. Stool softeners, this is going to help just soften the stool. Not going to make them go, but can help ease any discomfort that they have. A lot of times patients are super scared to have that first bowel movement after they've had a baby. But most of the time the patients always say it's not as bad as what they imagined. So I try to always pass that on to them to comfort them. And then nipple care. So if they're getting any breast tissue breakdown at the nipples, we can give them something called lanolin or Jack Newman's ointment. That is a medicated ointment that can be given to help with that nipple damage. And then also we just want to make sure that there's a good latch occurring to prevent nipple damage from getting worse. All right, our education. So this is going to involve several different things just depending on what's going on. So fundal height, we want to explain what we're looking for. So we're ensuring that the uterus is nice and tight and firm and it's involuting properly. The uterus is moving lower into the pelvis, so that's also going to help us to assess the lochia. That, remember, it should be a progression, the bleeding should be. So we need to educate on this because they're going to be going home, and remember, it's just going to be rubra really for us, so they need to know what to watch for. So it's going to go from that rubra red to brown and then to white. If it goes back to red, then they know that they need to call us. So if it's not progressing properly, then they need to call the doctor. And then contraception. So the patient probably does not want to conceive right away again, right? And we also don't want them to conceive quite yet. So they need to know their contraception options. And also they need to understand that lactation amenorrhea does occur. So if they're breastfeeding, they might not have bleeding, have a full cycle, but they could still ovulate and pregnancy could still occur. So they need to know that this is not a valid form of contraception at all. So what kind of contraception they can have. And then breast care. So just what they can do for nipple care and for non-breastfeeders. So for moms that aren't breastfeeding, their milk is still going to come in because that's what the body's meant to do. So they can do cabbage leaves. It's an old wives' tale, but it does work to help dry up the milk. They want to keep have no stimulation. So, have a good, tight fitting, supportive bra. They want to have, to keep the warm water on their back to prevent the warm water from hitting their breast. When the warm water hits the breast, it causes those ducts to dilate and milk can drop in. So good fitting bra, warm water to the back, cabbage leaves, Motrin for pain or ibuprofen. They can put some ice on it to help ease that discomfort. And then they do not want to ever hand express or pump or anything, because milk supply and production is supply and demand. So if the body doesn't know to produce milk, or it's not going to know if they're not hand expressing, the milk will eventually dry up. So even some more education pieces. So urination. We need to ensure to educate the patient to attempt to urinate every couple of hours. And that's because we don't want that bladder to get too filled up. And this will help decrease bleeding and also decrease infection because we don't want retained urine in there. Stool softeners can be suggested for hemorrhoids. And then hydration. So we want to make sure that they stay really hydrated. That's going to help with milk production if they're breastfeeding. We need water to make milk. And then stool softeners just to help with any constipation problems that they might have. All right, our nursing concepts for a patient with postpartum physiological maternal changes are going to be hormone regulation and patient education. So a lot of these changes are all related to different hormones, and then there's a whole ton of education that goes into this. All right, so that was a lot of information. Let's look at the main key points just to help you remember everything. So this postpartum time frame is the time frame when the body is getting back to its pre-pregnancy state. It's getting back to normal, or trying to. And this time frame, remember, it's going to take a little while. It's going to be 6 weeks. So they don't just have a baby and go back to normal. So 6 weeks to get back to that pre-pregnancy state. And then involution. This is the uterus shrinking and getting back into that pelvis. And then our bubble assessment. So our breast, uterus, bowel, bladder, lochia, and then our 3 E's is episiotomy, emotions, and extremities. Make sure you check out the resources attached to this lesson, review all the different education that you can give a patient, and then review that bubble assessment. Now go out and be your best selves today, and as always, happy nursing.